This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I'm very board-certified.
Well, that's an important thing to look for in a surgeon. Dr. Martin, how you doing?
Good. How you doing?
I'm good. I'm excited about our topic today.
So, we have a very esoteric topic. I mean, this topic is probably really good for a very small subset of the population, but everyone knows someone who could benefit from this surgery.
Yeah, and it's a good surgery to talk about because it's something we haven't ever talked about before. And it's a surgery that is primarily done on men,
right?
Which is also not something we talk a ton about.
No.
So in our podcast a few years ago, we talked about surgery specifically for men. And this is one of the ones we mentioned. So we're going to kind of do a deep dive into it today.
Yeah. If you like plastic surgery, if you like us talking about plastic surgery, you will definitely like this episode.
Yes.
And you definitely know someone who could benefit from this surgery.
Yes. So we don't have a ton of slides, but if you are listening to this and you'd like to see the slides, you can find those on our YouTube channel at Jason Martin MD, also on Instagram at Beauty and the Surgeon Podcast. So without further ado.
What's our topic, though? What's our topic?
Let's talk about direct excision neck lifts.
Interesting.
Mm-hmm.
So direct excision neck lift. So let's think about this, Amy. We do neck lifts through incisions that we've talked about many times before in this podcast. Where do those incisions go?
So the typical neck lift is going to have incisions that go around the ear.
Yeah.
Around the ear and then back behind the neck into the hairline.
Right. And I call that the occipital or eye, like I invented all the anatomy words.
You should.
Yeah, my words. The occipital hairline, occipital, which is behind the ear, the hairline that goes behind your ear. And that's where a neck lift goes. And it definitely goes in front of the ear a little bit. Sometimes we'll have an incision underneath the chin. We've had multiple episodes on neck lifts or face and neck lifts. And you can look at our YouTube or our Instagram, and you can see multiple examples of what that looks like. Amazing surgery, right, Amy? It's pretty transformative.
It is.
One of the most common surgeries we do, and a lot of people are candidates, usually people starting in the mid-40s going up from there.
Men and women.
Men and women.
Specifically, though, men of a certain age tend to have some considerations that make them maybe not as good of a candidate for an excision of that location and length. Mm-hmm. And that is usually related to hair loss.
Right.
So what do you do if you're a guy that doesn't maybe have a ton of hair in those areas? Can you still have a neck lift is a good question.
That's the first thing. What about if you have medical issues? What about if your age precludes you from doing it? And men in general tend to be less motivated to do cosmetic surgery anyways, in regards to going to the operating room, going under general anesthesia, the recovery, et cetera, et cetera.
Yeah. So this is a good option for all of those situations. Sometimes this surgery, so if you're listening and you've heard maybe of a W or a Z-plasty, W-plasty or Z-plasty, they probably
saw it on TikTok or one of those places.
Maybe. That's what this is. So direct excision literally just means we're excising the skin directly from the front of the neck versus pulling the skin from behind. So This is less of a neck lift and more of a
direct excision.
Yeah, direct excision. We call that a neck tuck maybe. I mean, I think actually in this situation, the word tuck works because we are kind of just tucking that skin away.
Right. So a normal neck lift puts the incisions around the ears, and that's what we would do that's the standard neck lift. In these special cases, primarily men, I guess you technically could do women if they're not a candidate for and I've had women with alopecia before. Mm-hmm. We have cases like that. You could do this direct excision neck lift, and that puts the incision right in the middle of your neck. So from your chin down to almost to the base of your neck.
Like right along the midline.
That sounds crazy.
Right? You think like, wow, I don't want a scar like that.
I mean, do you want a scar like that?
Well, not right now, but maybe.
Right. So that's where the rub comes. Like, wow, I don't know if I would do a scar like that. Is it worth it for the outcome that you get? So, I mean, that's what it is. These are these special circumstances, primarily men, usually older, usually in their late 70s, mid 70s, early 80s, really don't want to go to the operating room, or they don't have hair on the occipital hairline, and they're okay with having a scar on the front of their neck. What we'll talk about is that scar heals amazingly well. And some people are like, I don't understand why that heals well. Well, if you've ever known someone that has a thyroid surgery and they have the incision on their neck, or my son had something called a thyroglossal duct cyst.
Yeah, when
you remember that?
Yes,
yeah,
when he was just a little boy.
Yeah, and you can't even see the scar now. The neck, actually, the anterior neck or the front of the neck below your chin, actually heals really well.
Yeah, some surgeries are done through the front of the neck for
Totally.
that same reason. Yeah, I think everybody kind of understands the texture of the skin on our neck is a little bit different than the texture of the skin on the face. It's a little bit thicker. It's a little bit rougher almost. And for men, they have hair that grows there. So it's a really easy spot to let, your hair, your beard grow out while this incision heals for a couple of weeks. And then when you start shaving again, it really is impressive how that skin kind of almost hides it. And that's why we call it a W or a Z plasty, because of the shape of the incision that's made. So it's not just like a straight line. We actually make it in such a way that it really does hide it, because it's zigzaggy kind of.
So we can treat the audience like I treat the fellows right now. Tell them about W plasty and Z plasty.
Yes.
All right. God forbid you ever became one of the fellows that rotates with us, because we torture them. But so a W-plasty, you mentioned a W. I'm doing this now for all the listeners in the air, or a Z. Just do it with your fingers.
Like Zorro.
Yeah, like Zorro. Breaking up a scar. A scar is linear. That means a line. Breaking it up into making it go in different directions is not only good when it goes over areas that turn anatomically, okay, that kind of curve, or doing it over joints is another kind of where you would see this, but it's really good for the scar itself. That's how you break up the tension on the scar, and the scar will heal much, much better with a Z-plasty or W-plasty. So it is funny because you're doing it on these patients, and we'll get to the actual surgery. They're awake, and they're like, wow, that's a funny line. You sure you want to do that line? Why can't I just have a straight line? Actually, the line that has little back and forth, like a W in it or a Z in it. So if you have a straight line that goes to a Z and then a straight line again, or a straight line that goes to a W, am I saying this right, Amy? And then goes to a straight line again, will heal better and will have less scarring issues than a straight line itself. So this is a really key important point in plastic surgery, is lines of tension and the way you break up scars so they heal better and they don't become what we call hypertrophic or even keloiding. And that would be the worst scenario, is that you do a visible incision on someone's neck where it's obviously visible below the chin, and it becomes hypertrophic, which is a bad scar, or even keloiding, which is a scar that grows outside the boundaries of the scar itself. It's almost like cancer, to be honest with you, cancer of a scar. So that's what the W and Z-plasty does.
Yeah, so I think that makes a lot of sense. So really, just to kind of recap what we're talking about with the direct excision neck lift is literally just taking out that skin on the front of the neck.
Right.
The stuff that people grab, like their turkey gobbler or something that like hangs down over the trachea, just right in the center of the neck.
Right.
It doesn't address anything on the face. It doesn't pull any skin. It's literally just taking that loose skin out.
Yeah, so you should definitely, whoever's listening to this, should go to our YouTube channel and watch this also, or at least look at the before and afters on the YouTube channel, because they're not like what I would call transformative. But when you put it in relevance to these surgeries, take me a half an hour with local anesthesia, and you go from having a turkey neck to no turkey neck, and they have minimal recovery and minimal downtime, then you start to see the true amazingness of this really small niche procedure.
Yeah, and like why it's really good.
And it's always some older guy who's like, I don't care about this. I'm like, then why are you in my office?
Because he doesn't like that his neck hangs over his shirts
Right.
anymore.
I don't like wearing my ties.
Yeah.
My ties, when I squeeze my neck, the stuff hangs over. I'm like, well, I can get rid of that. Great. Let's do it. And that seems like every one of the patients.
Yeah,
so,
that is common with men who still wear like business attire.
Yeah, who wears business attire now?
But if you do and you have to button up a shirt or wear a tie and your neck is hanging over that shirt or tie, you don't really care if anything changes on your face. You literally just want to not have skin hanging over.
Not worry about the face.
Your
worry about the neck.
Shirt. Yeah. So who's a candidate? We've kind of touched on it. I mean, really anybody who is okay with the placement of the scar as a candidate for it if you have skin laxity on the front of your neck.
Yep. And you have to have enough where you can pinch it. You can like pinch an inch. That's probably a good way to look at it.
Yeah, lax, like really lax. And know that it's not going to make any changes to the face. It's not going to help with any of the other laxity of the neck. It's literally just taking out the stuff in the middle.
Right. Also, which we have not done, but you could do, if they had fat there, you could also do liposuction at the same time.
Yeah, we have actually. We've done some lipo at the same time.
Oh, we have? Mm-hmm. Okay.
Yeah.
That's my good memory.
Yeah. I set it up. He just does it.
Yeah. I don't know where I am half the time.
So yeah, you definitely could add like liposuction to kind of clean up the jawline a little bit, or even body tight, face tight to clean up the jaw a little bit.
Do some Accutite on the face. So it's not like you can't combine this with other procedures. But yeah, it's definitely usually someone older, usually someone that has a lot of stuff on their neck. They need a neck lift, but they just can't do it, won't do it, can't afford it, whatever reason you want to put in there, blank reason. This is a great secondary option.
Yeah. And it's also a good add-on. So say for a patient who maybe did have a face or neck lift 5 to 10 years ago, and they don't really need a revision, but they just have some redundancy or laxity right in the midline. It's a good option for addressing that.
Do you remember that patient we had?
Yes.
So he had a neck lift and he had a really nice result, but he had like residual redundancy underneath the chin and just got worse over time. And he was very Caucasian, very light skinned.
Yep.
That happens sometimes. And he found the direct neck excision himself, came back to me.
Yeah. So can you do this?
And I was like, really? And he's like, yeah. And that did it. And then his results were amazing. So whatever redundancy he had there after the neck lift was gone, and he was super happy. Yeah. Every time he comes in, he always like lifts his chin up. He's like pointing at it.
Look how good.
Look how good I look.
Yeah.
Look at this. This is amazing. Aren't you glad you did this? Yeah, I remember, that's funny. He brought that up.
Yeah. So you have to be healthy enough to have surgery. This is still surgery. So you still have to be healthy enough to have surgery. Can't be on blood thinners, uncontrolled blood sugars, all those things at a normal healthy weight. So as long as you're a candidate for surgery and this is the problem you have and you're okay with the scar, you might be a candidate.
But if you know someone, and I always say know someone, just imagine they're older and they have problems with their neck, but they do have health problems that are controlled. They may be a candidate for this direct neck excision versus a full neck lift. Like for sure, they're probably not going to be a candidate to go in and have general anesthesia, go to a hospital, have a 4-hour surgery. That puts them at risk, whereas a 45-minute surgery under local anesthesia, they're going to be a candidate for if their diabetes is controlled, if their blood pressure is controlled, and they're not anticoagulated or AKA on blood thinners.
Yeah.
Okay.
Yeah. So let's talk about the downtime and recovery, and then we're going to look at some before and after pictures and get into like the fun stuff.
Okay, good.
So as we mentioned, the downtime and recovery for this is very easy. It is a minimally invasive procedure. Yeah. You do have an incision that has some sutures. Typically, they're almost entirely internal sutures, so you might have to come back for suture removal a week out. Basic recovery, like a lot of the other procedures we do, got to keep your heart rate low for the first couple of weeks, and that's just to prevent bleeding or increase swelling, bruising, all that kind of stuff. Nothing where your neck is going to be in danger of being, overly manipulated for 2 weeks. Other than that, there's not a lot of, we never even prescribe pain medication for this. Nope. Tylenol, and a little bit of like taking it a little bit easy. If you're, very active and really love like swimming. I know you think that nobody asks me about swimming, but everybody asks me about swimming.
I don't believe this. You say this every time. Like not a single patient has ever asked me about swimming, especially in Colorado.
They all do. So if you love to swim.
Besides going to the ocean, I guess.
Scuba dive, or snorkeling friends. We probably will recommend 4 to 6 weeks off outside of a pool. You can shower right away the next day. Skiing, same thing because of the rubbing and also the helmet strap. Probably want you to wait 4 weeks for that. Other than that, you can be back to most normal activities in 1 to 2 weeks.
There's not many surgeries with this little downtime.
Especially with this type of result, which we'll see when we show the pictures, because it's an instant change. There's
totally
not
instant.
A lot of swelling.
And that's the crazy part. So when you inject it, it doesn't swell that much.
Yeah.
So, they walk in, they have this big turkey gobbler on their neck. And then you inject it, it doesn't really swell that much. And then right afterwards, it's totally different. Gone. And so they come out of the surgery, put some steri strips on, and they come out of surgery and they're like, oh my God, and it's usually a guy. And, I don't care. That's the way guys
are.
I don't care.
They're here because they care.
Yeah, but they're here because they care. But the real inside comes out. They're like, oh my God, this is amazing. Taking selfies at 80 years old.
Yeah.
So it's I don't know, it's such a neat, cool niche procedure. The history of this procedure actually has a basis in Colorado. There was a guy named Nize. We've mentioned him before, yes. Knize, which is such a cool name for a surgeon. It's almost like knife, like Dr. Knife, Dr. Nize. I don't know if knife is a good name for a surgeon. Really? It might be cool, but like that's kind of scary, like Dr. Knife. Well, the anesthesiologist today told me that he had a patient who was very tall, and his last name was Dick. And he texted who he thought his wife, my first patient was a big, his last name, as he thought it would be really funny as a joke. And he actually texted the wrong person. Yeah. So, maybe name text, maybe you shouldn't do that. Maybe you should especially when you're a physician. As a medical professional, you should never do that. Right. So, but anyways, Nize, I forget his first name, but he's retired now, very accomplished surgeon. He was the one who really brought this into the forefront in the 90s, doing the surgery. And he would do it, like we primarily do it on people that, I try to convince most people to do a standard neck lift, but he would do it on people that were in their 50s and 60s. Men and women? Men and women. Yeah, it's interesting. One of the only real, I was thinking about complications with this. I mean, there really aren't any, but obviously anytime you're having any type of incision, you run the risk of having bleeding, bruising, swelling, pain, all those kinds of things. Infection. We have had one patient who wanted a little more taken off. I mean, we chased that incision out a little farther. Well, that's the other part. Like the cool part about this is, and it's the same is true for our brow lifts. You should watch that episode. If you need more, I can just go do more. Take a little more. Yeah. It's you can keep using the same scar. You could do this surgery and come back 5 years later and just get a little more taken off. Yeah. So. And we've never had a patient, knock on wood, who's had any issues with healing or scarring. Who needed any type of scar revision or any type of any treatments even on the scar. No, not one. Yeah, and it does help. Men's skin does tend to heal a little bit better than women. Yeah, I think this. Also, at an advanced age, like as we've talked about in our episode about scars, we talk about how age affects the healing, and so if you're really young or really old, your scars are going to heal differently. Older people tend to have better looking scars because they heal really slow. And also because they have thin skin. Yep. So thin skin equals thin scar. Yep. That's another thing we've talked about in the healing episode. Yeah. So overall, great surgery. We're going to take a quick break so we can get a word from our awesome sponsor, and then we're going to come back and sponsor. See some cool pictures. Bye. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves. So basically, you're saying we're very choosy. We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it. Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home. Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone. And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right. We're back. Let's Get Checked really is awesome. Have you gotten your labs done lately?
No, I should.
You've been trying.
I tried. I'm going to have to go through Let's Get Checked.
Right, because LabCorp has been challenging.
Oh my God, they're
Such
reduced hours. I know.
All right, so as we teased before that break, we're going to show some cool pictures of this Direct Excision Neck Lift.
Which is really good for the podcast.
Right. So if you do want to see these pictures, we're going to do our best to describe them. But to see them, you can go to our Instagram, which is at Beauty and Surgeon Podcast, or at Jason Martin MD, or on YouTube. So this one is really great because it is immediately, this is the same day. So before and after, same day.
And it's unfortunate because I sent Sarah, it's actually, me and my creativity rotates patients on a big lazy Susan and videotapes them. At some point, someone's going to fall off this thing and I'm going to get sued, I think.
It's only like an inch off the ground.
All right. And there's a soft rug underneath.
It's very safe.
All right. So, and then I did it immediately before and after. This was the first patient I put on my industrial lazy Susan that I purchased and retrofitted. You did
Such an awesome idea.
Yeah. And then, so the video is even more interesting because I did it side by side, just split screened. But what Sarah did smartly, thank you, Sarah, is she took, screenshots out and you can really see amazing change. This is right after surgery if you're looking on our YouTube channel.
Yeah.
Pretty awesome.
It is. And like I said, it does nothing for the face. It does nothing to the chin. It does nothing to the jawline.
This guy's 81.
Yep. If you look directly at him, the picture from the front, like his mouth, he's got lines, he's got marionettes, he's got some other stuff going on the neck.
It just gets rid of the turkey gobbler.
Yeah, but it gets rid of that stuff right in the middle.
Right.
The stuff that hangs over your shirt.
Which, when men come in, that's what they hate. Mm-hmm. It hangs over their collared shirts. That's what every one of them says. I don't want this here. Or it just gets in the way. I can't shave around it, blah, blah, blah. And, I hate to say something we do is functional. Breast reduction is functional, but there's a functional component of direct neck excision neck lift.
I didn't think about shave. I am a woman, so I have some amount of expertise in shaving delicate areas, but that's like a large one.
Yeah,
like that's hard to shave around every day.
I don't have a turkey gobbler, thank God, but I can barely even shave without cutting myself.
Yeah, and to get like around something. Yeah,
you'd almost have to kind of like do a displacement. An upward.
I'd go to the side. Pull it this way.
You have to get your wife. Yeah. You have to get your wife to pull it over.
Pull on my neck so I can shave it.
That's when you know you love each other. That's when you know you love each other.
Yeah, see, that's
you're gonna make us late, making me hold this.
That's right. Should have gotten me to come in here sooner and hold your neck skin.
You gotta get some tape, honey.
Tape, there you go. Tape is the other option, but this is great. And if you're looking, the yellow on his neck is not a bruise; it's just a little bit of betadine that is hard to get off after surgery. So,
and then there's steri strips on there which are skin colored.
Yeah, that are covering that.
We have the fancy steri strips. Yeah.
So that's right before and after. This one, this is the same patient after it had healed. So this was several months later. You really, it's a pretty remarkable change in the area that is addressed.
Yeah, and again, all right. So we got to put this in perspective. This is literally a 45-minute procedure under local anesthesia, minimal recovery. They take no pain medications. They're back doing normal activities within a couple days and back shaving within, what, 2 weeks?
2 weeks.
Yeah.
Yeah. Yep.
And then you just transform their neck. I mean, this is awesome. So it's so niche. It's such a niche procedure. It's going to be an older man in most cases, someone that doesn't want surgery or can't do surgery for medical reasons or financial reasons. And but I just love the surgery so much. It really is perfect for where we are now in our culture. Instant gratification. You see it right away.
Yeah. This is another great example. This, like Dr. Warren said, like we probably all have someone in our lives who has a neck like one of these pictures we're showing, like just a neck. And this picture was a week later.
That was only a week. Yep. Yeah, he's way better now.
Yep, it's even better now.
Yeah, it's interesting that it's so funny seeing that because he's still swollen there.
Yeah, he's still swollen. You can still see some tension on the incision line.
Yeah.
In that picture too, which is completely gone.
It's all gone.
Like it really. It's something that I wish more people knew about because for men it really is and for women too. Who
maybe we could be the international destination for direct excision neck lift.
Yeah, we got to give it a special name.
Oh, I know. We got to call it the Martin lift.
Yeah.
You got to put my name on it.
And like we have to have some good descriptors for it. Yeah, but it's a really great surgery. I mean, I wish we had a straight on of him because his incision healed so well. I think we might on our Instagram channel.
Yeah.
But these people walk in, they walk out. We do have you have a ride just because your neck is going to be, kind of numb and tight. So you don't want to not be able to turn your head or feel like you can't turn your head. I mean, you can, but we do recommend having somebody drive you or at least be picked up by somebody. Other than that, I mean, you're not sedated. So there's no you can go back to normal stuff that day.
You know what's so funny about this surgery in this episode? What else can we really say? I mean, this is what's so awesome about it. We've never had an infection. We've never had a problem with the scar. The patients are universally happy. Now, I understand that they're 70s and 80s, so their expectations are lower than maybe some other people, which it shouldn't be. I think it should be the same as us. But we always exceed their expectations, always. And it's a group of people that thought they couldn't do anything to improve themselves. That's the empowering part. They come in and are like, I can't believe you could actually do something for me.
Yeah, and who don't want anything else. Like, these patients aren't looking to have their whole facelift. They're happy with how their facial aging is going for whatever reason. They don't want to change anything else. So what a great option. I mean, historically, this patient would have been only given the option of a neck lift. He doesn't have a ton of hair. Neither of these patients have tons of hair.
Even in the occipital. So usually you don't lose hair in the occipital area, but both of them were thin back there.
Yep, thin skin, fair skin. You had with this one who has more ethnic skin, one who's very, very fair skinned, tends to be more ruddy, fair skinned.
Right.
Both have scars that are invisible. This patient sent me a picture this week, just to kind of give me a little checkup at how it was doing. Everything looks really great. I wish there was more to say. It's an awesome surgery. Yeah.
So it's very complicated. Only I can do it well. No one else can. The Martin lift.
The Martin lift.
Yeah.
Come get your Martin lift. Well, we could call it the M-plasty.
The M-plasty. Oh, man.
Yeah.
Got to trademark the
the Martin medical plasty. The M-plasty.
Okay. Well, I mean, that's it. Direct excision neck lift. If you know someone who is older, has medical issues, preferably male, who has a big turkey gobbler neck, and they're not going to do a neck lift with a facelift and Botox and fillers and all the fancy stuff we do. There's an option. There's an option for them. Yes. This does exist. You have a scar in front of your neck from the chin down to the base of your neck, most likely. It's amazing how well it heals within a couple months. It's almost not visible. Especially if they have a beard, it's not visible at all.
I mean, if they keep a beard, it actually is not visible.
Yeah. Even stubble would hide everything.
Yeah. So, and that's actually something we didn't touch on when you were talking about why you do a W-plasty.
Right.
It's going to have less issues with hair growth as well.
Right. You're not going to get the alopecia whenever you break up a scar, it breaks up everything in terms of the way that it'll mix up the way the hair grows, so it looks more natural and everything else. So almost always, rarely do I do a perfectly linear scar. Even on the tummy tucks,
they still have a movement to them.
The scars have a curve; they're curvy linear, so they're not just straight. We rarely do a straight line ever.
Yeah.
So you're always following
for that reason.
Yeah, you're always following some anatomical kind of movement, the contour of something.
Because we're not straight. I mean, we're not flat. We're three-dimensional people, so our bodies, even the eyelids,
really profound.
We have shape. That's why our scars have shape.
You're telling the plastic surgeon we're not flat.
We're not flat.
Okay.
You gotta make a pretty ellipse on your scar.
Yeah.
Like, you do pretty things. Yeah. Yeah. All
right.
right.
One thing we didn't talk about, and Amy hates to talk about money, but it is definitely less expensive.
Oh, absolutely. No OR, no anesthesia.
Yeah, I mean, it's like a drastic reduction in cost.
I mean, really, because of the time, like you said, a neck lift is going to take you 4 hours.
Yep.
4 hours of your time, 4 hours of OR, 4 hours of anesthesia. This is an hour and no OR and no anesthesia. So if you took what you might in your mind think a neck lift would cost and cut that price probably by a quarter, that's about what you're looking at for this procedure.
Right.
And also just minimal downtime.
You don't need a Groupon. You just need to do the...
just doing direct excision neck lift.
Yeah.
The M-plasty.
Well, we'll take care of it.
Yes.
All right.
Anything else?
That's all I got.
All right. Well, now I'm going to ask people to leave me voicemails like I do at the end of every episode. So thank you all so much for listening to this episode of Beauty and the Surgeon podcast. If you found this episode interesting, educational, or just kind of funny and entertaining, please share us with your friends. We do appreciate it.
And like us.
Leave us a like, a rating,
Our YouTube channel's blowing up, man. We need to blow it up more.
We need to get to 1,000 so we can sell merch.
I think we're going to... So I'm going to make I shouldn't say this. I think we're going to get to 1,000 by the end of the year. I'm pretty confident about that.
All right.
And when we do, we are going to make the most bomb, pimp, diggity merch you've ever seen. I mean, like, I don't even know what it's going to be. It might be like cars or things that have high value.
You're going to merch out some cars. I don't know if Teespring has cars.
Okay.
Teespring might not have cars.
So it has to be like clothing or...
Clothing, cups. See, like our fabulous cups.
Yeah, fabulous cups.
Yes. So we would love it if you would give us some love on social media. It'd be amazing.
Great.
If you'd like to leave us a voicemail, we do have an episode coming up where we're going to play some voicemails that have been left. So we would love to have yours as well. We actually have
had a few, which, finally...
I know people have called me.
So desperate.
That number is in the show notes, but it is also 303-630-9038. I do listen to your voicemails. I would appreciate you leaving me a message.
What's the number again, Amy?
303-630-9038.
And you can look down below where Nils puts it there. There you go.
In the description box.
All right.
Thanks so much, everyone.
Thank you so much.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.